So let me show you here with a patient that has an ingrown toenail. You can see here, this is when they made the appointment. It's of the right toenail. And I am kind of hiding some of the content up top because of HIPAA. But what you'll see here is just the HPI here, ingrown toenail. The staff did all this right here in the right foot. He waited a little bit too long. Review his systems. If it's normal, you just click normal and everything pulls in as normal. Going down to the physical exam, his pulses were fine, no edema, integument. It pulls in something specific for the ingrown toenail. If you want to see the picture, what it looks like, okay, so it's the right toe. There's some pus down here, but everything else looked fine. So the way I will document that is with the right foot. He had a little bit of erythema down to the nail base. You just double click to do that. There's no probing, no granuloma. It was purulent to hallux nail base. You can put in C3 cc's. There was a little malodor.
Hi. Did you want to go into one to see Cameron? He's also here for an ingrown.
Okay. Yep, I'll be in there.
Okay.
So here you can see there was really no callus, no detachment, and the other side was fine. So we do that. It pulls in all these procedures. So as I mentioned before, if you, on the bottom of the video, if you just send me an email, I can send you all these procedure, the template descriptions and also the procedure descriptions. And if you choose Athena and just give them my name, they'll add your name to giving. I'll give you permission to use these, and I'll give you. You don't have to make them. So just tell them my name, and I'll put all that information underneath the video here, so you don't have to remake all of these. But if you want them, I'll give them to you. If you want to use them for another EMR, you can do that. The ones that I've made up, I'd be happy to give you. So the right, usually it says medial hallux, lateral hallux. In his case, it's just the great toe because it was more proximal. Some of the verbiage here, it says partial nail avulsion. I did just a partial. I'm probably not going to remove the whole thing on this gentleman. It has Paronychia. It has right and left automatically that pull up. And here's some home instructions that automatically goes in. I have some information on our website on ingrown toenails. This is the information about ingrown toenails, what this patient has, that we typically put in here. I usually do a 2-week follow-up, and I have different appointments. This is for Paronychia follow-up, so my staff will make that. This is what the note's going to look like. It's going to go to the primary care. Here's their primary care doctor that sent them over. And here's the billing. He's a new patient. Ingrown toenail, Paronychia IND with cellulitis. This will go to our biller. And that's what the note looks like. If you want to see what it's going to look like, what the doctor will get, it'll look something like this. Okay, with a little picture on there. So that's what it's going to look going to the doctor. And then you just hit sign and close, and that's done. So once again, if this was helpful, this is how we do a Paronychia, something you're going to do all the time. If you just send me an email or click the link underneath the video, I'll give you all the templates of how to do it, more like the discussions and the procedures. And then if you do decide on, once again, on Athena, just include my name, and then they'll transfer all my content to your content, so you don't have to add in everything manually. Because otherwise you'll have to go here and you'll add the macros are all those things that pull in automatically, and then the order sets, so you can kind of have all this stuff if you want, if it helps you. Just give them my name. Once again, it's underneath here, all the information you need. Hope you found this helpful.